Welcome to Double Helix, where everything is connected. Hey there, awesome viewers and listeners. I'm your host, Mark Merritt, and on this show, we're going to dive into the fascinating web of connections that shape our health and our lives. From our physical and psychological well-being to our emotional and spiritual growth. We'll explore how these connections, whether they're with the people around us or in intricate networks within ourselves, all the way down to our DNA, and how that can transform our lives for the better. Thanks for tuning in, and don't forget to hit the subscribe button and give us a thumbs up for episodes that resonate with you. Let's get connected. Well, good afternoon, everyone. We are live once again on Double Helix. I am very excited today to welcome Julia Hotz. Is it Hotz?
Hotz, you got it.
Okay, I keep wanting to put an L in there, so I so apologize. That's the first thing that comes to my mind. But you go by Jules, is that correct?
That's right, or Julia, whatever's easier.
Jules or Julia, okay. Let me tell you, I'll just do a quick intro, Jules, real quick. She is an author and a journalist and fellowships manager at the Solutions Journalism Network. She's a leading advocate for social prescribing, which I found very fascinating, which is an innovative approach to healthcare that connects people to community and meaningful activities as a way to heal. How's
That's right. That's great.
Awesome.
Thanks so much for having me.
We're so happy to have you. This is, like I say, we were talking a little bit beforehand, how excited I am. I've looked forward to this conversation since we touched base 6-8 weeks ago, I think was the first time.
Yeah.
So very much excited to have you on. So first question, just tell me a little bit about, I'd love to have our viewers hear a little bit about you from your point of view. And then, cause I can pontificate, right? But we're here to hear from you.
Well, likewise. It sounds like a lot of roads lead to connection. And, for me, I was a journalist who had reported on all kinds of health and mental health and healthcare interventions. I was a researcher before that studying loneliness. I was in the UK when they were the first nation to actually establish a minister of loneliness. But what I'd never really understood until writing this book was the way that actually it's very simple. If we want to feel less lonely and we want to also improve our physical and mental health, we have to connect to A, other people, and B, activities that matter to us. So I had learned about this thing called social prescribing, which is exactly that. It's this idea of your doctor, your social worker, your therapist, your allied health professional, literally connecting you to a community-based activity, whether it's an art class or cycling lessons or farming even in some cases. And the whole idea is shifting the conversation on health from just focusing on what's the matter with you to also including what matters to you. So that's how I got started.
I had no idea that UK is a minister of loneliness.
That's right. Yeah. Wow. And it was the sort of this headline grabby thing. And I was really interested in learning, okay, what does actually a minister of loneliness do? Yeah. And so I interviewed people who were lonely, and I kind of expected, I think a lot of people hear the word loneliness and they picture people who are older. They probably intuitively picture people who are physically isolated, but actually who came to this sort of talking group focus session on loneliness were a lot of younger people, a lot of married people, a lot of people who don't fit that sort of stereotypical picture. And that's when I realized, wow, now we have so much more research and data suggesting that A, more of us feel lonely, and B, it's really bad for our health. Some have estimated, actually a great researcher near you in Utah, Dr. Julia Hotz, was the one whose research has often been quoted in context of this idea that loneliness is as bad for our health as smoking 15 cigarettes a day.
Wow.
Yes. So that's bad. But, my book really goes into how it's not just loneliness explicitly. It's anxiety, depression, ADHD. Social prescribing can help really with all of that.
That's an interesting thought. And it's one of those things, as I've had many conversations with people off air as well as on air as we talk about this. And it's interesting, in the last few weeks, I've had several people bring up to me, well, Mark, it would be really good if you had somebody on there to talk about loneliness. And
Mm.
how do you get out away from loneliness? And that was even after you and I first touched base, right? So I thought, this is awesome. So those of you that don't know, and I'll put a screenshot of this up. Those of you that don't know, Jules wrote a book called The Connection Cure. So now you know why we really wanted to have her on with us, is because this is the stuff we're talking about. And so, yeah, so it's a fascinating thing that I've had several people in the last few weeks ask me specifically about loneliness
Yeah.
and how to get past that.
Totally. And it's great that it's, you're sort of giving this a platform and you're interested in it because I was surprised to learn that there's all these connections to metabolic health as well and
Hmm.
inflammation, and this makes sense like from an evolutionary perspective. If we were alone, we probably didn't have a very good chance of surviving. So it makes sense that our bodies would react to the stress of not having people around us as a way to find some people. And, our bodies have retained this mechanism so much so that, some fMRI studies suggest that the feelings of loneliness are equivalent to, or sorry, light up the same part of the brain as experiencing physical pain. The late great
Really?
researcher, yeah, Dr. John Cacioppo, was one of the first neuroscientists to put this issue on the map. And he compared loneliness to a hunger. And just as hunger cues our body's need to, refill our energy stores, loneliness is doing that with connection. So it's a good thing to be able to pay attention to the signal of loneliness. It's actually extremely advantageous that our bodies do this. The problem, though, is what happens next. And for a long time, the answer has sort of been, well, go out and make friends, go out and meet people,
My mother always said, go outside and play.
go
Right.
outside and play.
We go outside and play with the neighborhood kids and things like that. Well, now our society has so changed, especially, and this is where it really hit off for us for the podcast, um, post pandemic.
Yeah.
As the
Yeah.
pandemic hit, now all of a sudden we're forced into isolation in our
Mhm.
own little rooms,
Yeah.
and we've cut ourselves off from that face to face, right? From that, I actually had someone on one of my other podcasts, no, it wasn't a podcast. It was one of my coworkers in a meeting. He said, "Well, Mark, do you find it as beneficial to have face to face like this, like you and I are having right now, or is it better to be, as he rephrased it, belly to belly?" And I go, "A million times better if we're right in the same room together." And
Wow.
so, especially when our society has gone the way it has, where now we're scrolling TikTok and we're scrolling Facebook and we're doing Instagram, and if that isn't the loneliest activity to do, because
Yeah.
yeah,
Yeah. Yeah, and it's funny, like, I think you're totally right, and there's some really interesting research. I was just looking into this for an article I'm doing about, like, what does the data say? Not so much about social media and loneliness. Even that's a bit of a mixed picture though, but largely not
right.
good. But AI chatbots and loneliness. And it comes off of just this week, I think, or just this month, Mark Zuckerberg made a comment about how teenagers still have AI chatbots. And I thought that sounds ridiculous. But then you look into it, and some of the research suggests that what does an AI chatbot do? It's really about listening to you. It's about kind of
Yeah.
reflecting back a version of who you are. It's about making you feel seen. And some of my favorite researchers to quote on this, Dr. Arthur and Elaine Aaron, talk about that sort of being seen and understood as a key component of friendship. Um, you know,
Exactly.
so, yeah, I mean, but at the same time, I'm the first to say, okay, maybe, but like what are the risks of that? And why don't we start with trying to better connect people to the many real-world connections that do exist in the meantime? And that's what social prescribing is really about. Connect.
This stuff.
Yes.
We're actually right there close to each other. And
Yeah.
I've actually played around with an AI chat.
Yeah?
I like the chat Perplexity, because I've played around with 7 or 8 of them just for fun, right? And I opened up one of the chat bots out of this Perplexity, and I ask it a question. Now I want, and I actually did it. I want you to ask me questions to get to know me better and to get to know where I'm thinking and what should I do? And it was really interesting. The responses, it was literally asking me some really insightful questions that made me stop and
Wow.
think, to start reflecting on what I'm doing with this podcast. I actually used them weeks ago to go, how do I use this to help me be better with what we're trying to produce?
That's so interesting, and I'm the same. I used an AI chatbot to help me find that research, and I think that, insofar as what you said, like, it helps you become more insightful, it asks some really good questions. I would say that's what I want a really good friend to do as well. And I
Right.
think, what I thought was really interesting about the research on friendship, again, from these researchers I love, Dr. Arthur Lane Aaron, is they talk about friendship as being this evolutionarily adaptive thing. They call it the theory of self expansion. And it's this idea that we seek friendships to better understand who we are and how we can thrive in the world. And you might think, well, ugh, that sounds pretty selfish. That's what it's all about. But you got to remember, you're doing that in return for your friend. Ideally,
Right.
it's mutual.
Want to feel important and wealth, and cared for and things like that. It's interesting, we talk about, especially on the adult friendship side. I don't know if you've
Yeah.
read Mel Robbins' book, Let Them.
Yeah, yeah, she's
So
great.
she's amazing. That's a really fascinating thing that she talks about in there, where it takes, I think it was 200 hours of face-to-face time and socializing to be able to create a deep connection with somebody. Um, as a kid, that's easy. My mom
Right.
would say, "Go out and play with the neighborhood kids." Well, that's 200 hours before the summer's
Right,
over.
right.
But I can't think of another adult that I spend that much time with other than my wife,
Right,
right?
right.
Even my coworkers, I'm not face to face with them that many hours. And so I think you're exactly right. It's that we're reaching out, finding those friends for those connections. To I think some of it has, and I could be wrong. But I think some of it has to do with, we all have the need to feel needed.
Yes. Yes, that's exactly it. And that's a great segue to one of the types of social prescriptions I talk about in the book, which is service, right? Like, we it's probably not rocket scientist to imagine that, okay, like, we need to move our bodies to be healthy. There's a whole chapter about the importance of movement. Another one on the importance of nature. But the one about service that I found really interesting, and what so many studies show, when you look at the effect of volunteering on human health, is that it dramatically improves for all the reasons you talk about. We need to feel needed. We need to feel like we have purpose. We need to feel like our lives have meaning. And one way that we could do this is through some sort of act of service. And it's great, especially when we're doing this in sort of mutual aid networks. We're
Right.
serving some greater purpose, and we know that if we need it, we can be served in return. So that's exactly it. This need to feel needed and this need to feel like our lives have meaning.
Yeah, I think that is so important. And
Yeah.
I think, you talk about that our lives have meaning. I think we need to feel like we have contributed something. We've brought something to the table
Yeah.
that
Yeah.
we have been able to help somebody else with. Now, I know that can be very selfish, because I'm bringing something to the table because I want to help somebody, but also there's that feel good hormone that hits us, that, okay, that was a good thing. I feel really good about what I did. And that's, if we miss that, if we're not doing those things, we miss out on those. And that's that part of that connection.
Totally. Exactly. And if nothing else, we're not focused on our pain. There's a story I tell in
Mhm.
the book about, like, a woman named Akila who had this really debilitating back pain. And now Akila, when I meet her, is this lovely woman, this mother of two, caretaker, had worked in hospitals her whole life. And when she develops this debilitating back injury and is told she can't work anymore, she has to go and rest. she's absolutely devastated. Most people might hear that and think, great, okay, I'll rest, no problem. But for Akila, this was the psychological pain of not feeling useful, was as bad as the back pain. And so ultimately, I won't spoil it all, but she gets prescribed a spot volunteering at a children's charity so she can still sort of do that caretaker role. She can still sort of scratch that itch on the, at her job. She's on the phone all day talking to the parents of kids with these complex health needs. She feels really important, but she's not putting that physical pressure on her back. And lo and behold, Akila goes for this social prescription, and suddenly her back starts to feel better. Not completely cured, but better. And I think a lot of that has to do with the way her mind was focused on something else. And she was able to sort of reap the benefits of service.
Yeah, I agree. I totally agree with that. We had many of our listeners are aware that I was involved in a really bad accident a lot of years ago, and that actually isolated me for a while. And it wasn't until I got to sit, knee to knee with somebody else that was in a
Yeah.
similar situation. It was months later that all of a sudden that kind of started bringing me more out of it, and I'm like, okay, I'm back, right?
Yeah. Yeah.
And and I talk to people like, "Oh, you never changed." I'm like, "No, I did. It was
Yeah.
a pretty hard time." And so anytime I think something, whether it's physical, like you're talking about with this lady with the back pain, or even when you start getting into talking about depression and
Mhm.
some of the other things that really we tend to self-isolate when we start going through some of those things.
Oh my gosh, that's a great point. And it's, yeah, particularly with depression, there's something called the depression catch 22, which is that, when we're depressed, our symptoms are typically we have low energy, we feel a lack of motivation, we have a sad mood, and we want to just withdraw from people and the things that we love. We don't find joy in them anymore. What the research suggests, though, is that some of the most powerful medicine we have for depression is moving our bodies, is connecting with other people, is reconnecting to those things we love. But the very symptoms of depression oftentimes keep people from doing that on their own. And so that's where a social prescription can be so helpful, because it's a doctor saying, and by the way, this is not in replacement or suggesting it's better than medication. The person I'm talking about,
For those that need those things, yeah,
for
yeah.
those that need those things, absolutely. But for, one of the people I talked to in my book, in addition to medication, she gets a social prescription for this sea swimming course. So not only is she moving her body, she's in nature, but she's also with other people, and sort of gets in this virtuous cycle of, okay, well, my doctor prescribed me this, so I'm going to go. She goes the first time and it's a little bit easier to do the second time. And after the second time, it's a little bit easier to do the third time. And wouldn't you know it, by the end of this social prescription, this woman had made all these friends, develops a new hobby she loves, continues that hobby even without the social prescription, and is eventually able to go from the maximum to the minimum dose of her antidepressant. So it's not just, hearsay. The mental and physical health benefits of this are extraordinary. It's all
Yeah.
connected. You should have a bell for every time someone
every
says that.
every time something that comes up that way. So, I mean, and we named the podcast that for a reason, right? Because
Yes.
it all really is. It's all integrated into that. Um, what I sent you 3 questions to kind of ponder.
Yes. Yes.
Yeah, and I'd love to kind of touch base on a couple of those.
Yeah.
Um, and so you've brought up this lady that did the swimming. I love the swimming idea. That's such a really cool prescription that a doctor would write. Um, the third question that I sent you, it says, for listeners who want to take action in their own lives or communities, what are a few practical steps they can take to foster connections and advocate for a more holistic approach to healthcare?
Yeah. I think it's a great question, because I think, like, a lot of people might be listening to this and thinking, well, that's great for Amanda and Akila, who happen to live in England, where social prescribing is
It's,
more,
it's,
more
it's more
mainstream.
established. Yeah, yeah, yeah.
Yeah, but I imagine, like you and me, many of your listeners are probably based in the US. So
Uh-huh.
they're wondering, what can I do here? Well, the good news is there is an incredible organization called Social Prescribing USA that's trying to make what happened in England to happen here. They're getting doctors together, they're working with medical associations, they're working with other nonprofits to try to research and document and spread the gospel of social prescribing. So my first advice would be, if you, particularly if you're a healthcare professional, get involved with them because they're leading the charge. But if you're just a person listening and thinking, I really want a social prescription, there's good news too, because you can start by prescribing yourself some of these things. And there's a resource that goes with the book, www.socialprescribing.co, where, first of all, you can ask yourself some of the questions that you might want to ask to find your ideal social prescription. So, the cardinal
Interesting.
question
Yeah.
is, what matters to you? But, that's a little bit broad and vague. So, if we break that down, we might have a question like, if you had 2 more hours in your week, what would you spend it doing? Or when you were a kid, what did little Mark love to do? What was something that little Mark would do for hours and not get bored, when was the last time you experienced awe, this feeling of wonder and amazement at the world? For some people, it's music. For some people, it's nature. So ask yourself these questions, which are all on the website. And then with that knowledge, maybe you've identified a category. There's a list of all the different organizations and nonprofits and groups I reference in the book that either have free or donation based spots in groups that allow people to do these things. Now, I know you're based, for example, in Utah. I'm in New York. Many of the organizations I list have chapters all around the country, with some even available to join online. But even in the meantime, even if you don't find anything on the website that's appealing to you, I encourage just to start with those questions and
Yeah.
read about some of the science. Like, it's not in your head that nature and movement and art and service and belonging are good for us. There's so much data supporting this. So I would say to dig into that too.
Yeah, that's great. And we'll make sure that we put up a link to that so people
Great.
can go right there, and I'm going to jump over there when we get done today and go over there and just check it out, and it'll be kind of
Yay.
neat to see. And
Great.
that's socialprescribing.co.
That's right.
All
Perfect.
right. All right. I'll make sure that we get that link up there for everybody.
Thank
And
you.
all right. And then the next question, and we're winding down because we mentioned we were going to be just until a few more minutes. You reported on social prescribing initiatives around the world. What's one story, you've mentioned a couple, or a case
Yeah.
study that really illustrates the transformative power of these programs for individuals and communities? Is there one that really you go, and that's not in your book, one that you go,
Mm.
oh my gosh, this is a great story.
Mm. Yeah. Well, this one is in the book, but
Okay, that's okay.
the benefits of it, I keep hearing about it, and it's the one that, of all the ones I've written about in the book, it's the one that speaks to me the most, probably because I'm at an age where
Great.
my parents are a little bit older and I'm starting to see some changes in them. And it happens in the country of Norway, which was the first country in the world to establish what they call daycare plans for people with dementia. So that means if you live in Norway and you have dementia, your municipality is responsible for putting you in a sort of daycare program. And I went to check one of these out, kind of like with a little bit of an eyebrow raise. And again, my own sort of skepticism and biases about what dementia is and dementia care is. And I go to this farm. And on this farm, every single person there has dementia. Now, these people are picked up from their houses every day in a minivan. It's the same sort of like 9, 12 people every day. They come to the farm, they do a big walk around, they eat a meal together, they clean up together, sharp knives and everything. And then what do they do in the afternoon? They go out and they work. They polish eggs from the chickens. They sometimes even clean up cow manure. They feed the cows. They, tend to plants. I mean, they're engaging with the animals and the plants in such an incredible way that totally blew my mind for what we think when I heard about people with dementia, you know, and I hate saying this out loud, I kind of thought how terrible that is because you're cut off from your faculties, you're cut off from so many activities and passions and your memories. But what I'd learned while being in this environment is that you can't even tell people have dementia. And some people do have it really severely. I mean, when you really talk to people and they repeat things, you say, okay, I understand. But the
Right.
point is, when you're put in what dementia researchers call an enabling environment, an environment that reminds you of the things you still can do, all other elements of your health improve too. I think sometimes one of the worst things we can do when people lose some sort of ability is to over focus on the lost ability and not focus on the abilities that still remain.
That is so true. That is so true. Years ago, when I was my very first public speaking gig. So I mentioned an accident, and I spent a lot of years in a wheelchair after the accident. And my very first speaking gig, I remember going to, and I get up on, I'm in a wheelchair, I'm up on stage, kind of sharing everything. And the focus of is that really we can, if we focus on that part that I've lost, it's that what Stephen R. Covey called that circle of influence and circle of concern,
Mm,
right?
mhm,
And
mhm.
so my focus was on what can I do?
Yes.
And it was really interesting after the fact. I told my wife it was the one time in my life I felt like a rock star, because there were all these people that had come up and they wanted to talk to me, and you're like, okay, this is so bizarre to me, right? And
Yeah.
and then there was this one man that stayed off behind, and he finally comes up and he's weeping, and you start. It was to the point I almost felt uncomfortable, right?
Mm, mhm.
And then he came up and he said, for 15 years, all I and my legs and my back have had problems, and all I've told myself is I can't do this anymore, and I can't do this anymore, and I can't do this anymore. He said, I've never thought, what can I do?
Wow.
And he says, while
Wow.
you were talking, I'm thinking, look at all the stuff I can do. And he said, I've had this new lease on life. And I went, oh my gosh, really? I mean, to me, it was normal, but it was really neat to see that, as you're talking about going from what can they do, what do they have the ability of doing still, because they can still
Mhm.
contribute in
Yes.
so many ways.
Oh, what a beautiful story, Mark. I think that just and sometimes, just as I'm sure um you felt good hearing that, it sounds like you really made a difference in that person's life. And that's I'll just end by saying I think that's the real beauty of social prescribing, and it's all connected, because what we're doing here is we're not only like helping individual people feel better from their different ailments, but we're also reconnecting them to each other. In that story you just
Right.
told, what would have happened if I don't know, you weren't in the same room, you weren't belly to belly, and he couldn't have told you that afterwards. So I think it's as much about improving our health, improving our healthcare, as it is sort of improving our culture.
Right. Exactly. Well, Jules, thank you so much for coming on. I cannot tell you how much I've enjoyed our conversation. I would love to get you on another time and we could explore a little bit more.
Yes, we need a part two.
Yes, a part two would be great, great. And so thank you very much. I can't tell you how much I appreciate you being here. And for all of our listeners, if you have questions or comments, please put them in, and I'll make sure we get those passed on to Jules, and then we can go from there, and hopefully we'll get you back soon.
Thank you so much, Mark. So great to be
All right.
here.
Yep. Thank you very much. We'll talk to you later.
Talk to you later.